Hi guys, welcome to Plastic Surgery Education. I am Nikhil Panse and today we are going to discuss a different topic than we generally do. This is a non-academic topic, but yet it is very important to us as plastic surgeons. It is about record keeping data, retrieving data and so on. So we have with us my dear friend Anushka. So she is in this IT and digitization and digitalization stuff. So we will be discussing with her about all these details and she'll guide us as to how we can make effective use of IT and help in better record keeping. So I am how are you?
Good, good. How are you?
All good, all good. So essentially all my questions are going to be focused on plastic surgery. I will be asking you regarding the impact of IT on plastic surgery. But before going to that, can you tell us a bit about what actually is digitization? What actually is digitalization?
Right. So, first of all, thank you so much for inviting me, and I'm very happy to talk to a doctor about IT. So, digitization and digitalization. First of all, these are two different terminologies.
Yeah.
Digitization is a simple like you have a register and you are converting that data in digital format. So, like basically you are capturing that data in Excel, then that is digitization. Digitalization has some broader aspect to it. So when you leverage the technology or advanced technology for business benefit, for change management, for creating a new value, then that is digitalization. And commonly used buzzword in the industry nowadays is digital transformation. So whenever you visit any kind of conference, you must have heard about digital transformation, digital health. So these are the words that are commonly used in the industry these days.
Right. So as plastic surgeons, our main concern is we don't have time to maintain the records. What we would like to have is pre-op photographs of the patient, post-op, follow-up at 3 months, follow-up at 3 years, follow-up at maybe 10, 12, 13 years or so. And that should be seamless, that should be easy, that shouldn't be very time consuming. We shouldn't have to go in and look for it. So the easier it is, the easier it is for us to maintain records, the more we tend to do it. So how can this IT and this all this stuff help us? I know there are a lot of softwares available in the market, but can you be more specific, more precise about how you can help us do it?
Right. So if you see there are say 14, 15 types of listed software available in India. And if you see for every software there are thousands of vendors, right? Thousands of options available for you to select from. Starting from OPD patient registration to hospital management, then your radiology kind of stuff, inventory management, pharma, everything there are. At the same time, for CRM, like we call it as customer relationship management, or you can say patient relationship management, finance, HR, and other kind of management stuff. There are multiple software available. You must have heard about artificial intelligence. So very commonly used word in every industry you can reach. So there are beautiful plugins that are available like chatbots, voice to text conversion kind of software, analytics software, decision making software, which you can just have those kind of plugins in your existing software and you can use it. Mostly doctors tell us that we don't have time to enter the data. We are very busy with interacting with the patient. You have your operations. Many doctors roam around in different hospitals for various surgeries and looking at patients. So they really have less time to enter that data.
Yes.
So there are different smart plugins available or apps available which you can use for capturing the data on the spot. Like you always have your mobile with you. You can go, you can visit your wherever you are going, and you can capture that data. So these kind of options are also available. Then there are some options available with respect to IoT, that is Internet of Things. These are sensor-based applications. We start from basically monitoring your basic parameters like your heartbeats, your steps, sleep. You must have heard about it. So from that to asset tracking, these kind of applications are also available under IoT. Nowadays, these applications are also used for hospital management. So there is you can say vast canvas in which the different kind of softwares are available, and it's just about you choosing the right one for you.
So Anushka, you talked about various hi-fi things, chatbots, AI, obviously it is in vogue, IoTs and all these things. The general idea of the public is as plastic surgeons, we are rich surgeons, but it is not so. We have poor surgeons, plastic surgeons are the poorest of all surgeons. So obviously, the next question, which is a typical Indian question, is how is it going to pinch our pockets? So how costly is it basically?
So first of all, I tell you that look at IT as an investment and not the expense. I'll give you one example. Whenever you come up with a new setup or you plan to have your own hospital, what do you think about? You think that there should be a good kind of environment in my setup. The devices, medical devices should be high-end, upgraded, good to use, latest in the market, well maintained. Then you look for a good consultant. If the setup is bigger, then you look for a good consultant that needs to be visited in your setup. So why you do all these kind of things? That is your investment, and at the end, you think that my clinical as well as the patient feedback should be good. My patient should feel good,
Actually,
and that is that for that particular end result, you do these kind of investment. So similar is with IT. So it's an investment, and I would say we can start small always. So of course there is a range of software, small IT tool, and then you can keep on using. Use a small IT tool, test it, get the outcome from that particular software, and then slowly you can start adding different kind of features to your software. There are two types of software we say. One is the on-premise kind of software and cloud-based software. Cloud, when you say on-premise software, it is a one-time investment. So you do all the capital investment one time and you just pay for AMC. So that is one kind of, I'll come to the amount also. And second is cloud, in which you don't have to do much capital investment in that. It's on yearly basis. But then it's not exactly the AMC. You have to pay the same amount on yearly basis. So coming to the average of it, a good software, legally compliant, and for say 30 bedded, 50 bedded hospital, starts from 50,000, and then it can go in crores. Like this.
Annual cost you are mentioning.
Yes. Yes. So as a consultant, we always recommend for a cloud-based setup, especially when it's a doctor-owned hospital and there is no formal corporate structure in the hospital. Because when you have on-premise kind of setup, there are a lot of responsibilities with respect to it. You should have a good network, then you should have a backup procedure in place. You have to maintain the access control software and many other things are there. So we recommend to go for cloud-based software when you don't have a formal IT setup in your hospital, your team.
Right, you have made that absolutely clear. The legal aspects of all these softwares. As plastic surgeons, we take a lot of photographs, especially of the patient's face, and we are concerned about the confidentiality aspects of the patient. We wouldn't like these patients to go into public domain. Obviously, we take consents, but even then. So, what are the confidentiality implications and the medical legal implications of using all these softwares and apps?
So first of all, getting into that, I would like to tell you some guidelines. Whenever you go for purchasing any software, there are few guidelines that we should. Whenever you go for purchasing any software, have a good contract with the software vendors. Because that should ensure that you have taken care of data privacy. In case your data is lost, then you should be able to retrieve that data again. So, and there are many other things that has to be taken care while doing this kind of contract. So whenever you go for purchasing the software, ensure that the contract is made. These are the basic guidelines. Secondly, there are two kinds of terminologies that we use in IT. I'll try to make it simple. One is whenever you purchase any kind of software, there is a configuration that is required.
Yes.
So configuration means, say you have a 100-bedded hospital, then for 100-bedded whatever things are required, then you have say 10-15 consultants configuring those. You have say 5 OTs in the setup, then configuring the same. You have some forms available in that, so making those forms available depending on the speciality of that particular setup. So these are some of the parameters which comes under configuration. That is very much allowed, and every hospital has to go for it.
Yes.
But second part is customization. So making the software in the way I am operating my setup.
Yes.
So there are chances that you may end up changing the SOPs. You may end up changing the workflows. Many times, hospitals changes the whole form of patient registration or capturing the OT notes and all those kind of stuff. So avoid customization. Wherever possible, avoid customization. Because it has a different kind of implication. Once you customize the software, you cannot take it as a evidence for proving medical legal.
Oh, is it?
Because you are already done the changes in the software, so how one will, how you can ensure that my software is foolproof? Because you already made the changes.
But if there are certain requirements from my personal perspective, I would want the changes to be made.
So that is development of new modules. It's not changing the existing software. So I'll give you one example here. For example, there is an appointment management workflow already exists. That is a standard workflow across all the hospitals that a patient, take the appointment, say telephonic or register or your portal. Appointment comes in the your system, then you assign a token. The patient is sent to say center 1, center 2, center 3, and then OPD is over or whatever action is taken after that. This is a standard process. You don't need to actually customize the what you can do, what kind of changes you may need. So we have just 2 rooms and then our OPD is over. But then that is not customization, that is configuration.
Okay.
So try to avoid customization as you mentioned that you need something that is not there in the software, that is a new development. That doesn't come under customization.
Got that.
So whenever there is a medical legal thing, ensure that your software is properly licensed. You are licensed all right. Secondly, there is authorization and access control. I'll give you one example again here. So if you are solely handling the software, then there is no need of having such kind of things in place. But when there are 10-15 people in your setup and everyone is handling different kind of model or everyone is handling different kind of responsibilities in the setup. So in that case, say one A, B, C, D, 4 modules are there. As the owner, you have access to A, B, C, D, all 4. There is one nurse, she should have access to only B module. There is some finance person who should have access to say C. So this access control should be in place. That is the another prerequisite when you go for a paperless kind of hospital and you show maybe it could be medical legal or NABH or ABM, any kind of compliance you go for. If you want to have software as your base, then these prerequisites are required.
Got it. So you mean to say, as owner of that particular maybe hospital or owning that software, I have the potential to limit the amount of data or whatever it is there to certain individuals.
Perfect. Yes.
Now, taking the same question forward, we as plastic surgeons fall into different categories. Some of us are freelancers. We operate at different nursing homes. Some are attached to corporate hospitals. Some have their own hospitals. Some have their own nursing homes. And there are some who are also in government practice or in academic teaching institutes. So the requirement for all of this is quite different. I mean, the requirement of anyone who is working in a corporate sector is going to be different than a hospital owner. So can you elaborate a bit on this as to how we can customize it based on individual requirements of individual plastic surgeons?
Right. In our when we started our conversation, I mentioned that there are multiple software which are available in the market.
Yes.
And for a particular software, there are thousands of vendors that are available. So why so many vendors are available for a single requirement? The reason is the software are different for say starting if we see there is a 10-bedded hospital, there is a 1200-bedded hospital, then the requirement changes. If it is a specialty hospital, it is a super specialty hospital, single specialty hospital or multi-specialty, the requirement changes. If it is a daycare or bedded hospital, the requirement changes. What is the literacy level of your staff? Software changes. Whether your setup is in tier 1 like Pune, Mumbai kind of cities, or your setup is in tier 2, tier 3 cities, then the requirement of software changes. Your staff, IT literacy, and many other parameters are there when you select a software. Now, there is a surgeon or there is a specialist who is working in single premise, and there is a person who is working in multiple premise. Like she has her own clinic, and then he or she is, going in different hospitals for consultancy or surgery.
Right.
So, there are two types in this. One is you can have your own mobile app because you carry mobile everywhere, and it is easy for you to capture the data in the mobile. So one option, if you have your own mobile, if you're carrying a laptop, then you can have that as a web-based system on your laptop also. And secondly, you have that if a single patient is coming to clinic and the same patient you are referring to hospital, then you need that data synced to each other. So in that case, it is totally dependent on what kind of policy the hospital has. If hospital is allowing you to capture that data in your own software in their hospital, fine, you can do that. Otherwise, you need to capture that data in their software. So it is totally dependent on what kind of policy you and the hospital follow.
I think you have addressed most of our queries that we have. Now, there is one thing which I would like you to address is the Ayushman Bharat initiative. It is coming up in a big way across most government institutes. It is there in private hospitals also. It is coming up gradually. So, how can we use this technology for those with private hospitals to be a part of the Ayushman Bharat thing?
So, many times people get confused between Ayushman Bharat and Ayushman Bharat Digital Mission.
Yes.
So those are two different things. Ayushman Bharat is a different kind of initiative with respect to health by government. Ayushman Bharat Digital Mission is a digital mission that government has taken. So under which the first important thing that government has started, that is about issuing a unique ID to every Indian citizen. So if you go to Ayushman Bharat Digital Mission website, who I don't know who has designed, but we can say that government has tracked the ecosystem very well. Like they are not just talking about this unique ID given to the patient. In this ecosystem, or from a digital angle, from IT angle, they are connecting every hospital, every doctor, every insurance company, every pharma company, every patient. And that's the ecosystem government is looking at through Ayushman Bharat Digital Mission, in which the first step is already taken by government, that is issuing of Aadhaar, that is the unique ID for every Indian citizen for healthcare record. Like we have PAN for our financial record, it is similarly for healthcare record. So that is the big way that is coming in, and that's why the consultants like us are telling everyone that you start taking the steps towards digitalization, because see, government may not do everything mandatory at the end of the day, but we will not have choice but to go digital.
Yes. So you mean to say this Aadhaar card is the next big thing, and we all should be a part of it?
Yes. We need to be part of it. I think most of the insurance companies have already made it mandatory.
Right.
So indirectly,
we have
to go further.
Now, I think coming to one concluding question, you are part of the Olyphaunt technologies. how have you contributed a bit about yourself in the journey of IT? And obviously, you are easily accessible. I can contact you at any point of time. But how can other people who are interested, they can get in touch with you, and how can you help us as plastic surgeons in our work?
Being part of Olyphaunt Solutions, we are basically consultants. We are IT consultants. And we, first of all, whenever we talk to any doctor, we don't have our own software to sell.
Okay.
So we are consultants. We assist you, we help you to identify the right software. We help you to implement that software, and we help you to achieve your vision about digital transformation. So that is the role we are playing. At the same time, when we started Olyphaunt Solution, we could see that healthcare is the sector, especially in India, healthcare is the sector wherein we have adopted IT, but for say medical devices, in that angle we have adopted the technology. But when it comes to patient monitoring, patient data, hospital management, we are way behind.
Right.
So there is a lot of space, there is a lot of scope wherein we need to adopt IT. Being part of Olyphaunt Solutions for last many years, we are actually trying to find out the early adopters.
Okay.
So those are the people who is going to, who is going to adopt IT first. They are maybe aware about what are the implications, what are the advantages of adopting IT. So Olyphaunt Solutions is in search of those early adopters in IT, and we are continuously doing that. Definitely followers are there; they are anyway going to follow. But we are helping those early adopters for achieving their visions, because they will be the one in the market with respect to hospitals, doctors. They will be the one in the market who will be called as leader in their own domain.
Yes. So recently we had a survey about who are the smartest of the surgeons, and there was a unanimous opinion that plastic surgeons are the smartest of all the surgeons. So I think you have targeted the right population.
Great.
Obviously, plastic surgeons are going to be the early adapters, and it was wonderful talking to you and having you here. So thank you, Anushka.
Thank you so much. Thank you.
Olyphaunt Solutions is an IT consultancy company assisting various doctors and hospitals to achieve their digital transformation goals. Olyphaunt Solutions is a bridge between IT applications, software and doctors, hospitals. They start the journey for any setup with a digital transformation assessment. Starting from identifying the appropriate software to assisting the setups as their extended IT team. In this journey, a team of Olyphaunt consultants work very closely with respective IT vendors and compliance experts to give the hospital end-to-end results. They assist the hospitals in becoming ready for NABH digital accreditation and ABDM. Thank you. For any more details, you can connect them through contact details on screen.